So let's talk about your lungs, emphysema in particular. So in your lungs you have these little gas pockets called alveoli. What they do is they exchange the oxygen you breathe in into your blood and take the carbon dioxide out of your blood. Now what happens when we damage these? They start looking a little bit more like this. Much larger pockets, actually less surface area for the gas exchange to occur, so we get a lot more breathlessness and less oxygen into our system. How do we damage our alveoli to look like that? Well, basically it's via cigarette smoking. There's a couple of other things, such as a constant chemical exposure to chemical vapors or wood dust. There are sadly some people who have a genetic disorder called alpha-1 antitrypsin deficiency, and they will also develop emphysema over time. It happens very slowly. It is sadly irreversible. The lungs do not regenerate, and so a lot of damage can be done before we actually have any of the symptoms occurring. So symptoms are traditionally breathlessness on exertion, so running around doing stuff. It progresses to breathlessness when we don't exert ourselves. There's also wheezing, coughing, and a cyanosis type look, which is a blue tinge to the skin, which is when we do not get enough oxygen into our blood supply. So how do we diagnose emphysema? Well, it's via a spirometry test, which is something obviously a doctor normally does. Some pharmacies offer this service as well. They also may do some blood tests and a chest x-ray. The number one thing we want you to obviously do is to try to avoid emphysema by giving up smoking. Now obviously at your pharmacy you have plenty of options in regards to nicotine replacement therapy, from patches to gum to mini tabs to sprays, you name it, we nearly have it nowadays. The doctors also can prescribe a tablet, and what that tablet does is that blocks the nicotine receptors in your brain, and over a 12 to 24 week period it turns those off so that you do not crave nicotine anymore. So there's one way to help prevent emphysema.